Hi, everyone. Welcome back to another Zoom interview with medical professionals on the BHS Public Health Forum. Joining us today is my pediatrician, Dr. Tracy Daley from Center Pediatrics, right here in Brookline. Dr. Daley, thank you so much for your time today.
Thank you so much for having me.
So today we're going to be talking about sleep deprivation and how it relates to our mental health and stress. So let's jump into our first question. What are the most frequent issues you see among your teenage patients? And what are the consequences if they're not taken care of?
So sleep is very, very important in all age groups. Typically, the younger you are, the more sleep you really do need to function your best. So typically what we see in the younger age group, those in preschool and school age, you should be getting about 10 to 12 hours per night. Those in the preteen, I'd say 9 to 10. Teenagers, 8 to 10, and young adults, about 8 hours per night for optimal sleep health. So what I typically see in teenagers is sleep deprivation. And that could be caused by a whole host of things. One of the things could be poor sleep hygiene. And what I mean by that is certain individuals are going to bed at various times on various evenings. That could be due to working on social media long into the night. That could be listening to music during those hours, binge watching TV, or it could be, they have a project due at school, they procrastinate a little bit, and now for the next 4 to 5 nights, they're really not getting much sleep. So that's the big thing, it's poor sleep hygiene. There are some teenagers who have other issues going on. They may be diagnosed with a mental health disorder. It could be depression or anxiety, and maybe that's why they're not sleeping. And they will talk about they will talk with their PCPs for those issues to be addressed. And some teenagers may have medical reasons, like for example, they have enlarged tonsils, they're snoring all the time, and that's why they're not sleeping. So, but for the most part, for healthy teenagers, I usually see the deprivation due to poor sleep hygiene on their part.
Most important. Sorry, keep going. Sorry if I interrupted you.
That's fine. That's fine. So that could sleep deprivation for everybody, particularly teenagers, can lead to a whole host of issues because it really negatively affects your physical health, your cognitive health, your behavioral health, and your mental health. So it's getting enough sleep is very, very important.
So it's important to have a very consistent sleep schedule, right?
Correct. Correct. And if you don't, oftentimes physically, that can lead to general malaise. So during the daytime, feeling kind of sleepy, groggy, you're not very motivated, feeling fatigued throughout the day. That's one thing. Definitely, cognitively, it could really affect you. And, particularly those of you, with the stressful school schedules, not getting enough sleep can really have a negative effect on your academics. So oftentimes it affects your ability to sort of process what's going on in the classroom. It affects your problem solving. It affects your memory. It affects your multitasking. It affects your attention to detail. It affects the way you can organize your work. So not a good thing to be chronically sleep deprived if you want to do well academically. Also, looking at behaviors, those who aren't getting enough sleep, sometimes they could be easily agitated and irritable. So it's sort of, in a bad mood all the time. A friend of you can just make, sort of a benign comment. You could just blow up, get very angry for no reason, and all because you're not getting enough sleep. So as I'm saying, sleep is very, very important to your general health.
That's really good to know. Thank you. So I guess you already covered the effects of sleep deprivation. What else can you do to improve your sleep hygiene besides like creating a consistent sleep schedule?
So the consistency is very important. So consistent in going to bed and also having consistent wake time, that's very important. Another thing is at least 30 minutes before going to bed, preferably, I think 1 hour is better though, taking away stimulation. So you turn off your cell phone, turn off your TV, get rid of your AirPods. That's very, very important for you to sort of create a environment where you're induced into falling asleep. When your brain is stimulated, you really can't get off to a good start when you want to go to bed. So that's very important to take away the stimulation. There are some people who are very affected by caffeine. So, you don't want to have caffeinated drinks, before going to bed. Some people are very affected by sugar, chocolate bars. It's no good for them, before going to bed. So definitely want to avoid that. You also want to be in a very comfortable environment. You don't want to be in a room where it's too hot or it's too cold. If it's the winter time and your home is a little on the chilly side and you need your favorite comforter, use that to fall asleep. And also another thing is you want to exercise if you can. Studies have shown those who exercise a good 30 to 40 minutes during the day, they actually sleep better at night. So that's a good habit to get into anyway, just to keep your body healthy, and it's good for your sleep hygiene. So those are the main things that I would recommend.
That's great to know. Thank you.
Sure.
Now this question is more related to sleep deprivation and mental health, but what is the relation between the two?
So there's a huge relation between sleep deprivation and mental health. So not getting enough sleep can even cause you to be anxious. It can cause you to worry about things for no apparent reason. You could start worrying about your schoolwork when you don't need to, worrying about your relationships, worrying about your weight. You could become, so worrying about your health, even developing, some hypochondria. So certainly it can make you more anxious. Some people with sleep deprivation, they become depressed. They, don't really want to engage in the activities that they normally have fun engaging in. They don't want to be around their friends. They're isolating themselves. They're lonely, and they really can't get motivated to do what they normally should do, all because they're getting depressed because they're not getting enough sleep. And so it really affects your mood quite a bit, whether it's depression or anxiety, or if you already have problems with depression and anxiety, it can definitely make it worse. Yes.
Okay, that's really, I guess that's really important, especially in a time where I guess currently a lot of schools are remote, so it's like taking that time to like step away from this computer screen. Yeah.
Very, very important. And especially when there are certain school schedules where it's not as structured as other schools. So sometimes people get into the habit where, they feel they can get away with getting into bed at maybe 2 a.m. and then getting up at, 7 and, just prepare the work for the following day. You really can't get away with that for too long. You really need to go to bed at a set time to really get your good 8 to 9 hours of sleep. That's very important.
So what suggestions do you have for us, and where can we seek help?
So, what I talked about with the good sleep hygiene, that's very important. And you also, and there's another thing also. If you feel that you've turned the light off, you've had the stimulation is gone, it's a comfortable room and you're still having trouble, one of the things that actually great is actually doing breathing exercises. That's wonderful. And what I mean by that is you take a nice deep breath in, hold it for 20 seconds, and then you're going to breathe out nice and slow. And you can do about 10 to 12 of those, and that really, really relaxes you. So that's another good thing to help yourself to get to sleep. If all those things aren't really working for you, you're still feeling anxious, you're feeling depressed, or you think there's another issue of why you can't sleep, you definitely need to speak with your PCP about that because they can really, really help you. And I don't recommend any medicated sleep aids. So, you know, you definitely don't want to take anything like Benadryl to get to sleep. That's a no-no because that can have a counterproductive effect. So I
That's
would
really
just
good.
try the sleep hygiene and the relaxation techniques. That's the best way.
That's really good to know, especially the breathing exercise. I actually didn't know about that. That's so surprising. But it
Yes,
makes sense.
it helps you.
I guess, yeah. So those are all my questions. Thank you
Okay.
so much.
Absolutely.